Hi, I'm Peter Grobitsky from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. I am pleased to introduce to you the best papers of the January issue of the JVS, Venous and Lymphatic Disorders. The Editor's Choice article this month is entitled Deep Venous Thrombosis Associated with Caval Extension of Iliac Stents. The article was written by Dr. Erin Murphy and her colleagues from Dr. Raju's Vein Center in Jackson, Mississippi. The authors compared results of iliac vein stenting in 982 limbs when using the Gianturco Z stent extension to the wall stents with results in 755 limbs treated with wall stent alone to treat iliac vein obstruction. The iliac stents in both groups were frequently extended into the inferior vena cava. At 5 years, cumulative freedom from deep vein thrombosis was significantly higher, 93% in the Z stent group versus 81% in the wall stent only group. More importantly, the 5-year freedom from contralateral DVT was 99% in the Z stent group and significantly less, 90% in the wall stent only group. No patient with a properly placed Z stent technique had a contralateral DVT. The authors recommend to use the Z stent modification, which not only provides greater radial strength to the iliocaval confluence, but also significantly decreases the risk of ipsilateral and contralateral deep vein thrombosis at 5 years. Read this important article and the accompanying editorial of this issue and change your technique to avoid late thrombotic complications of iliac vein stenting. In 2017, you will be able to earn your CME credit by reading a paper in the JVSVL. Our first CME paper is entitled Long-Term Complications of Inferior Vena Cava Filters, written by Dr. Wang and colleagues from Santa Clara and Los Angeles, California. This retrospective study of 96 IVC filters with a mean follow-up of 61 months observed a 14% fracture rate, a 13% IVC occlusion rate, and a 70% perforation rate for retrievable devices versus a 15% perforation rate for permanent devices. Long-term complications after IVC filters were common, and they varied with device type. Higher rates of fracture were seen with the Cordis Optis and Trapeze filters, whereas higher rate and degree of IVC perforation were seen with retrievable conical type devices. Given the high incidence of long-term complication, it is important that you inform your patients and their families of the long-term risk of IVC filters prior to placement and promptly remove retrievable filters when the risk of venous thromboembolism subsides. The next article attempts to determine the origin of superficial venous reflux in the groin with duplex ultrasound and discusses implications for varicose vein surgery. This paper comes from Germany and it was authored by the Solomon family, Paul, Christine and Philip, and their colleagues. The authors investigated different patterns of reflux in the saphenofemoral junction in 2019 legs of 1,673 consecutive patients with chronic venous disease. Most frequently, in 66.7%, the reflux had its origin in the common femoral vein. In 8.4%, in the common femoral and in the abdominal wall veins. In 21.3%, the saphenofemoral valve was competent, and reflux originated in the abdominal veins, and in 3.5%, the saphenofemoral valve was competent and reflux originated in small tributaries or in the saphenous perforators. The authors concluded that reflux in the saphenofemoral junction did not involve the terminal valve in 24.8% of the legs, implying that routine high ligation and high ablation of the great saphenous vein close to the terminal valve might be over-treatment in these patients. Finally, the last article is on endovascular management of chronic total occlusions of the inferior vena cava and iliac vein. It was written again by Dr. Erin Murphy and colleagues from Dr. Raju's group. The authors evaluated outcome of 71 patients who underwent IVC stenting for chronic obstruction. Technical success was 85%. There was no mortality and very few morbidities. Primary assisted, secondary patency rates at 60 months were 52%, 85% and 93% respectively. When technically successful, symptoms after IVC stenting improved, pain completely resolved in 66% and partially in 91%, and ulcer healed in 56%, and there was no ulcer recurrence during the 5 years. These were just a few of the many excellent articles from our January issue. To access these articles free in January, please visit us on www.jvsvenus.org. Enjoy reading all JVS journals and see you next time for the highlights of the March issue of the JVS Venous and Lymphatic Disorders.